Alright, we're going to talk about some other antiarrhythmic agents. We're going to talk about adenosine, potassium, magnesium, and other. Again, we're looking at the Lang pharmacology cards, watching them on Kindle. So let's first look at a case. A 29-year-old woman with a history of paroxysmal supraventricular tachycardia since adolescence presents to your clinic complaining of the onset of palpitation 2 hours ago. She denies any syncope, dizziness, dyspnea, or chest pain. An EKG demonstrates a supraventricular tachycardia at a rate of 180 beats per minute. You try to break the arrhythmia with carotid massage, but you are unsuccessful. You decide to send her to the ER, where you expect she will be given a medication that will attempt to treat her condition by increasing the potassium efflux out of the cardiac myocytes. Again, you expect that she will be given a medication that will attempt to treat her condition by increasing the potassium efflux out of the cardiac myocytes. So let's look at these other antiarrhythmic agents. So, for example, adenosine. So the mechanism of adenosine increases potassium efflux out of the cells of the sinoatrial and atrioventricular node, thereby hyperpolarizing the cell and decreasing the frequency of the cellular activation. Clinical use for adenosine: diagnosis and treatment of supraventricular tachycardias. Side effects: flushing, dyspnea, hypertension, and heart block. So that was adenosine. Potassium mechanism: by increasing the extracellular concentration of potassium, the threshold for a cardiac action potential is raised, therefore making it more difficult for an action potential to be generated. Thus, the rate of cardiac myocyte excitation is reduced. Clinical use: suppresses ectopic pacemakers, especially those associated with digoxin toxicity. Side effects: hyperkalemia, cardiac arrhythmias, paralysis, and shock. So that was potassium. Now magnesium, the mechanism for magnesium. Although the exact mechanism is unclear, magnesium is believed to have effects on the ion flow through sodium, potassium, and calcium channels. Clinical use: used to treat torsades de puentes, also used to treat digoxin toxicity. Side effects: hypermagnesemia, magnesemia, hypertension, delayed deep tendon reflexes, paralysis, and shock. Other: the class 2 antiarrhythmic agents are the beta blockers, referred to propranolol and metoprolol. So they have non-selective and selective beta blockers. Remember that propranolol is the non-selective and metoprolol is the selective beta blocker. So we talked about adenosine, potassium, and magnesium as for these and other antiarrhythmic agents. Thank you.